All right, everyone. So thank you so much. I hope so you can see my screen by this time. Just confirming and hello to everyone and New Year. Yes, 2023 is going on. So that's fantastic. And congratulations to all the doctors who just recently passed the MC exam. So which is also fantastic. So great. So no worries. We're going to start very shortly our, sessions and all this thing. Great. So just taking a few seconds before we start. That's okay. All right. So, dear doctors, from the beginning, I like to ask from which, city or country you are attending this session. Please let me know in the comment section. Yeah, great. So we are transmitting this session in our YouTube channel as well. So if anyone is having any issues with Zoom, can also check our YouTube later. So not a problem. So we can see from the list that there are doctors from India, Bangladesh, Pakistan, of course. And at the same time, a lot of doctors are also attending from Australia, New Zealand, and many of the other countries, actually. So that feels great. All right. So we're just taking little time, guys, just to, you know, um, make sure that the doctors are joining. So we're just taking a little time actually here. So probably what we can do, we can just start in next 3 minutes. We can chat, and maybe at the same time we can ask one, two things to some of the doctors, like how they are doing. I can see Dr. Ajay is here, Dr. Joe Matz is here, Dr. Anustri. So all the, some of the, good doctors who passed AMC in recent time, I can see them. And I'm sure, they are also excited about the MC2. I mean, their MC1 also went very well. There were some fantastic groups. They have been studying really, really well. So I believe, the same thing, guys. It's all about, you know, carrying you. I mean, and, put into in certain situation, give yourself challenges and things. Anything can be doable, actually. So there is a something in MC2, people say, oh, it's a so difficult exam, too hard to pass. But trust me, if you just go with the, same hard work or which you put in MC1, I can assure you there is like 75% chance of passing, because our passing rate was 75% in MC2. Our MC1 has much better passing rate, it's over 90. But in MC2, we are also trying our level best, and we try to screen more actually before going to the exam. We take little time. I mean, we are not into planning, just hop on, hop off. Uh, See, a very funny thing to start with, in MC part one, in my opinion, the syllabus is even more bigger. Now, some of you would be laughing on that. Maybe I'm telling lie on things, but I'm an instructor for both. So I can tell you from that, like, actually in MC1, you imagine, how much things you read, just for the MC1, if you remember. Like there were so many things, you have to study. I mean, almost universe, all the topic, maybe, you feel like you were studying, right? So do you agree on that one? You can put that one in the comment section. That's also okay. Um, if you agreed that, there are so many topics in MC part one, you just have to keep studying, keep studying, keep studying, like, feel like a, whole universe you're studying, something like that, never ending. Now, in MC2, is it same like that? The answer is no. It's MC2. It's more about tricky, and it's more about, just see, if you are become a master of around like 250 cases, let's say 200 to 250 cases. So I'll take the maximum limit, 250 cases, and keeping eye on the same way. Like, see, in MC part one, you used to keep eye on, the latest recall, latest questions. The same thing is here. that, you need to keep eye on. So go with a standard course, where the maximum important cases would be covered, and keeping eye on the new things. We understand one thing, that, as like the same in MC1, you have to be creative. What our plan was in MC1, see, we used to do a lot of things, definitely make a lot of tricks, um, theories and all these things. But at the same time, one thing I try to promote as well, that, uh, I can help you how to swim, but you have to swim by yourself, right? The same thing I used to do in MC1 as well. A lot of things have been instructed, but, at the same time, there's a certain thing with a lot of exams and thing came that, how you can swim, it's up to you, right? So you find your own way. That was important there. Actually, the same thing is also here, that will show you the direction and all this thing, but uh, things should come naturally, so now this brings us to one of those very important point in MC exam, that there is a term called rote learning, which has been introduced in MC1 since last 2 years. So if your exam looks too much structured, and even in MC1 they might ask you question. So few of the doctors were asked, actually I told, like, it is nothing, it will be fine. The same thing is in MC2. If they find you are too much, structured. Okay, so example, I tell you a case, this way you have to tell. Believe me, the uh, instructor know about these things, because there's hardly very limited institutions, right? I mean, and a lot of things are quite similar. So a lot of time I try to be a little unique on that thing, especially word choosing and paraphrasing. Some of these things I usually try a little different compared to some of the other things, because the structured things, normally they find it as a red flag, that, oh, this doctor has just memorized it. So if even if your case is too good, everything's spontaneous, but if the examiner thing, you are being structured things too much, they can give you fail, and that is something happening. Do you think so many doctors are going, even they pass MC1 with flying color, then they go to MC2 and then they fail? What can be the reason? So the major reason is actually is too much structure. So as like same in MC1, I encourage you, like, you should have a 3 or 4 people group, and you find your own way. Will also help you, guiding a lot of things, how it is done, right? So are we clear with the instruction, guys? I mean, are you guys getting me? Please let me know in the comment section that if you guys are with me and understanding the points. I'm just trying to little compare and contrast, actually. I'm in more interested in taking my MC1 students in MC2. So we take limited students, but my first priority, those have been coming through MC1 in our academy, they will be the first priority. Because a lot of things they have been instructed. I know I have also trust on them, and they have also trust on me. So the work become more easy in that case for us. When you get a group who trust on you, and you also trust on them on their techniques, actually. So uh, even in MC2, if numbers are limited, but I would prefer the close group, those who have been good studying very good and following my instruction well, that time only I request them to join. Actually, I usually don't run MC2 too much commercially, to keep the passing rate and things, because I in MC1, say, it's more like a one way. If you listen to me, many cases more than enough, but in MC2 there's a lot of factor that depends, right? So we have to be careful about those things. So we limit the number to very less. In MC1 we are taking like 150, 200, even some batches, but it doesn't matter, because it's most cases I'm telling the most of the things. But here you also will have voice, and you have to tell a lot of things, and there would be things like role play. So if I take doctors like 100 and things like that, and if I keep promoting MC2, there will be outburst of lot of interested doctor. So we usually keep quiet in MC2. I usually prefer, and I usually approaches to the closest students to join, so that I can work with them and make sure they pass, actually. All right. So this is important thing. One more thing, as like in MC1, if any of our student get failed, they can keep using our contents and the things. Okay. So in MC2, it's a very big thing. Any institution giving you this kind of words. That's also very important. That okay, like so we have your back. So that's most important. So with that note, there'll be a lot of advices coming up in next, you know, probably in 4 months. But let's just go and focus on the current. Uh, give you an idea and clear. Maybe some of you already have idea, but let's just go with one more time that in about the station notes and what are the things to use, right? Great. So you'll see, a lot of our, things are a little different and more animated, colorful things we use. We also, provide the recordings. Okay. So any of the live classes we are taking, we are also providing the recordings. Recordings are usually posted after 24 hour of the class. Next thing is there's another group of doctor. They usually request in that way, doctor, I want to join you, but I want to join you little later. So for them, you can take away any of the batches contents, like which includes notes and the videos and some of the role play recording sessions and all this thing. You can take away those things and join us for any of the batches later on, actually. So that option is also available. So you can also consider that, usually this kind of offer is just to make sure, like, why that kind of offer. It is because that, see, uh, as I mentioned, there was like I think my video is turned off. I can turn on myself. Yeah, that's okay. All right. So the thing is, I hope you can see me. Yeah, that's okay. In MC2, you will get to see me very often. So get familiar with my faces. Yeah. Yeah. Great. So thing is here in MC2, as like there, I was telling, there was like, 250 cases. So among those, 250 cases, you need to uh, be a master. So say, if you're not planning to start with us now, you can take away the contents and all these things, and you can start maybe after 3 months or 4 months. But in between, my suggestions would be that every day finish at least one case or maybe two case. In that way, say if you're joining after say 4 months, how many cases you are finishing? If you are at least finishing, you know, one case a day, then in next 4 months, and trust me, finishing one case takes like a 1 hour. Just for information, finishing one case is like a proper way of seeing the case, reading, thinking and watching the video and things. So it may take usually 1 hour actually. And then you can take your notes and that might take 15 minutes. So it's like a 1 hour, 15 minute, right? So every day you can spend that. Even if you're not studying properly, you can do that actually. Like every day, a little bit study. And there is a very clear instruction in MC website. Your MC1 knowledge will be reflecting on MC2. So most of you are recently passed, so you have very good knowledge on lot of things like on John Muttag and many other aspects. So you should use it properly, before you start forgetting it. Okay, so mind it, very, very important information. Okay, many doctor later they message me when they regret a lot of things been taught. It's okay. I mean, there's a lot of versatility you will find in MC2. There would be other academy opportunities and the things like in MC1. To be honest, there is very less competition I get actually. But in MC2, because of, as I said, marketing, and we don't do much marketing in MC2. So, but I look forward to our some of the regular students actually, just because I cannot accommodate more than 30 35 in my batches. So that's the one of those points actually. All right, so even those are our students, we keep the price value also low, just to make sure, my motive is to just work with them. Okay, and because they trust me and I trust them, so that's the reason, we offer our students so some discount and the things in joining the AMC2. All right, so that's the thing. So because I want to work with them actually, it's in MC2, especially those I'm comfortable actually, because when you request, like, see, if you know me very well from the beginning, and if you request me anything, I cannot say no, right? Yeah, so that something that works in MC2 actually. So something came up, doctor, this thing, can you look into it? And there are also class monitors and the thing, they also remain close actually. So they can also tell them, though they request us, okay, in an extra class. Yeah. So we used to do it in MC1. The same thing we like to do in MC2 as well. That, but as you can understand that, It is not possible with big groups. So summary here, uh, those you those of you passed, it is very much recommended to join now. If you can't join now, for your sake and for your own good, you can subscribe to it, because courses are way cheaper, almost similar like MC1, so you can afford, like, while if you go in MC in Australia, these are like $6,000 courses. Actually, I'm not telling they're bad or anything, but the money that matters also a lot, actually. So you can just subscribe, access to the notes, access to the videos and things like that, so you can keep studying. Actually, even if you join in Australia, you have a plan, no, you have to join in Australia by $600, I don't mind on that one. But even if you join them, make sure you study, because those courses are very fast furious, like finish in a month. But if you're not ready, and so your money will go in a waste in that case. All right, so coming to the point now, in MC clinical course, in that case, so far these are the stats are important, maybe not for you but for me, actually. So 860 doctor passed, which is an amazing, I think, result, which you must be agreed so far. That's in total our, the AMC things, actually. This is the list. And if we go with, some of the latest success in MC2, these are the things. So congratulations to these doctors on passing in MC2. MC1 has a very big list. You can check our guideline group, actually. And now coming to the introduction and the format of the exam. So please let me know in the comment section, are you guys are ready now, actually? By the way, guys, this is the open session. You can invite your uh, friends as well. Okay, so if you have a friend or a study partner, you can just tag them or copy the link and also send it to their messenger or WhatsApp. Okay, today's class is a open link, my dear doctor. So please invite some of the friends to join, and they also witness something, good session and get a good idea. All right, great. Okay, so let's go and start. So introduction, first of all, do you really want to know about the format of the exam? Yes. All right. Okay. Good news. Yeah. Okay. So that's like routine. Normally, our MC two classes are Saturday and Tuesday. Yes. So class times are same. 8:30 p.m. Is the Sydney time, and 3 p.m. is the India, and 3:30. So classes are mostly like 2.5 hour. Usually as like the MC MCQ, and some cases maximum limit is a 3 hour, actually. All right. So if you're familiar with our days in MC, one like a Sunday, Thursday, here the dates are Saturday and the Tuesday. Some cases we add a extra day, that can be on the Wednesday, some cases. All right, let's focus on the format and things of the exam, actually, for now. All right, great. All right, now there's two things in MC2 exam. I'll check your inquiries as well, and I'll be also answering them later on. Not a problem, actually. Great. Now, this is like the scenario in MC2. I hope you are familiar with this. Yes. All right. So see, so 16 station. Guys, my video is on, by the way, so you can click on the Zoom link on the site, and so because I'm talking, you can also watch. That can be also nice. But if you feel like that's a disturbing, then you can minimize that as well, actually. Great. All right. I'm just trying to be familiar with you, and in future, when we actually take the classes personally and another thing, we usually try to keep our videos open just to make sure everyone is attending, because it's a very closed room group, only very limited people, and especially those are doing role play, we do the video role play as a tutor, because in main exam though, so instructor would be there or the role player would be there in front of you, right? So if you practice in that way, so this is the first learning thing: never practice without the video, never practice you know uh, just by audio. Okay. Some of the maybe people do that, very common and number one mistake. Never do any role play on by audio. This is the first learning thing today. Okay, so 16 station for rest station, actually. Okay, now next thing is coming. Do you know how many format MC clinical exam can be done? Now that's a weird question, right? Now, one that is, it is Melbourne based. We all know that, but there is an online based also available. Do you know this, my dear doctors? There is an online based also available. So please let me know in the comment section. Do you know about this thing? The answer is a yes. So there is a online based available. So if you live in Bangladesh, if you live in India, so you can also take the exam from there. So it's like the same how I'm sitting right now in front of you. There will be also role player. They'll be taking your exam. All right. So it can be also done in this way. All right. From your own country, you can take this exam. Now, about the update of AMC online exam, it is still that, we are taking this session on um, this January 2023. Till date, this exam exists. Are you getting me, guys? Till date, this exam exists. I mean, you can take it online. Okay. But in future, we cannot tell that, it will remain. But so far, we can see April date, May dates are opened up, and they also have that one actually. All right. So that's the thing. Which one is better, online, offline? Those I will tell you in our personal classes someday. All right. No problem. Oh, great. So there's a lot of points to be told actually about that. So which one? So we'll talk about that one in coming days actually. All right. So first of all, I mean, talk about the format of the exam. There is 16 station and 4 of them are rest station. You can enter in the exam only. The very first one can be a rest station. All right. The very first one can be rest station actually, or very first one can be a physical examination station. Okay. And there will be rotation, like, you have to rotate actually. You have gone through OSCE exams, I'm sure, in past. So it is kind of similar like that, but here with patients and a lot of things. If you go to the Melbourne actually, so it is a center based, it can be Zoom based. We'll tell you the differences very shortly. Don't worry. Okay. Now, MC clinical online exam. So a few of the things you can see um, from the checklist actually. All right. So you can see like some of the lines animation we try to put in MC2 just to draw your attention actually. By the way, guys, if you join later in the side corner, if you click, my video is also on, by the way. All right. But if you find it distracting, you can remove me from there. It's okay. Great. Now, we'll brief you in separate session. I mean, pros, cons of online exam in details, but few of the things let's discuss actually. Right. Now, you need to have a PC or a laptop device and all these things for this particular exam. You might be in Bangladesh, India, Pakistan, anywhere you can take this exam by online format. Is the exam fees is same? Yes, the exam fees is still same. Even though online, you must be thinking, okay, maybe I'll get some discount on this exam, right? Some of you might be thinking like that. I mean, little discount on online exam. No, it is unfortunately not applicable. I mean, discount on online based exam. To be honest, from 2023, all AMC exam prices, maybe 100 AUD is increasing rather. Okay. So no matter you go online based or you go Melbourne center based, your prices are same actually on that exam. What is the exact price? You can go to the MC website, always check because they keep changing. And this, certain month, it is supposed to change actually. So please keep eye on it actually. Or someone check the website and confirm us in the comment section. Yes. All right, because it is supposed to change from January actually. So if I tell the old one, so it can be changed in the next month actually. So better you go to the website and check actually would be better. Now, in this one, how much changes from the original exam? Now, is the format changes. Now, do you have any idea? Now, for that one, you need to know the format of MC2 exam, right? So there is like a 2 minute and 8 minute. 2 minute to see the screen. You'll given a screen like this, even in center, even in online, you'll be given a question on the monitor and you'll get a 2 minute. And when you enter, there is 8 minute. Okay, is that format has changed in online exam? The answer is a no. It doesn't change. It is remain the same actually. Now, what else additional? Now, there's a huge security check in that case in online because you can have devices, you can have things, someone can be sitting near to you, you can have an airpod, someone is instructing. Yeah, maybe you can request me, doctor, can you instruct me by earphone? No, I cannot do that. Yeah, just joking. Yeah, so I mean, so they will do a lot of security check actually. So make sure one thing, one doctor shared with me this thing. She was my student actually, and she also cleared. She was having, PC, to the desktop, and they're asking her to, move because it's like a iMac, the iMac, right? It has, its own webcam. Now, if you are using, like right now, I'm using not a separate webcam. I'm using the computer one. Right now, I'm using my computer one. All right. So in that case, if they want to do security check, I have to remove my whole laptop in that way. And that's become difficult in those exams, right? So, and if you have a desktop, imagine it's even more difficult. So make sure you have a webcam. Again, I'm telling you need to have a separate webcam because they will ask you to move it here and there, every direction. Now, there's another word you can say prompt. Anyone has any idea what is the word prompt means? Anyone? You can unmute and tell, my dear doctor, please, for to help others and make it more interacting. Can anyone add something like what is prompt means? Anyone? Quickly unmute and
Yeah, in prompting an exam, basically.
prompting an exam. Yeah.
Yeah, so
In
basically your
AMC.
time is over for the history, basically, or for the task, basically, and you shift on to the next task.
Yeah. So the quick question is this prompt is given, can be given prior. It means in the beginning of the MC clinical exam, is it possible that they will tell you that at the 4th minute, you will
They
be
might be, but
prompt for,
not. But if it's written in the question, actually, if it's written in the
yeah.
question, you will
So
be prompted. Then only you have to.
yeah,
Otherwise, you have to prepare in your mind that
otherwise
yes. Otherwise, sometimes the examiner don't tell the time. They'll just when you
they'll
8 minutes
examine.
is finished, you have to just go out of the room. That's
Great. Now, coming to that point, actually, this is that some of the difference in MC online based exam. So many of the cases, there will be prompt written actually that, prompt, maybe it can be an instruction, it can be a thing that at 4th minute, you will be, shown physical, you'll be given physical examination findings, or at 4th minute, or at the 5th minute. And some of the prompt, as mentioned by Dr. Itinder, that they can give you also time to time, please move to your next task. Some cases, some prompts are also given in that way. Even in the main exam, when you go to the center, some cases, if you're taking too much time in the history, some cases examiner can tell you, you can move to your next task. Okay, just to guide you or instruct you. Okay, keep that one in mind actually. Okay, I'll turn off my video for a second just to keep the screen a little bit more clear. Okay. All right, now this is the prompt part. We'll see more with the prompt when I'll show you some of the role play in coming days. So then it will be more clear, how prompt looks like actually. But, it will be mentioned in the question, and some of the prompt can be coming in between the exam actually to move to the next task. Physical examination adaptation. Now, this is a major, major change. Now, can you do really physical examination? Because, I mean, normally in center-based exam, you will have a patient and you have to perform that on that patient or on that dummy. But in online-based exam, how you gonna perform physical examination? So the answer for that one, you really don't have to perform physical examination. This is the biggest difference here, about the physical examination perform, right? So very, very important about the physical examination performing. Let me keep a copy. All right. So main thing we're telling about some of the differences in MC clinical online based exam. And as you can see, we just talked about the format change. We just talked about the security check. There'll be more security, and there's a prompt. Prompt would be given in the question that, when to perform physical examination, when to perform that particular task. In online based exam, the instructions are given much more clearly. All right, because it's mostly one way. Right. So mostly you are the person who is talking. Now, physical examination adaptation, I mean to say, you don't have to perform on a patient, but you have to educate a medical student. Okay, so it is kind of like that. You have to educate some of the medical students. Say, example, a liver examination probably, or maybe a knee joint examination. So you have to educate a. Say, example, if you have ever worked as a medical register or as a teacher, the job become more easy for you because you have guided and instructed someone well, right? So that becomes more easy in that way. Otherwise, you need to practice that one because it's like a one way you are telling. Normally, how we do physical exam, our hands normally goes, and we use running commentary. We examine and we keep telling. So in the main exam, we examine and we keep telling. We call this method running commentary. That's more easy. Some people examine it and then they talk. So that's another technique. Okay, so running commentary we prefer more actually. It's more easy so that you will not forget telling things actually. Like, you just keep checking. I appreciate there is no such swelling, tenderness, this, that. While running commentary easy, but if you tell it later, you have to memorize everything and tell. So that's some cases you might miss some point. All right, great. Now, physical examination adaptation, hope you understand. Now, explaining this thing to medical students. So this is a lot of cases you will get like this in online based exam. We're talking about the AMC Part 2 exam, online based actually. All right. Now, examiner's role. Quick question. Let's see how much idea the doctors got. Because in the main exam in Melbourne, there is an examiner sitting right next to you. Okay, he's marking you with all these things. In online based exam, will you be able to see the examiner? A quick question. Let's see what's your idea. The new doctors, please mention in the comment section what is your idea on that one. Will you be able to see the examiner in the side corner? He's sitting as well. No, you can't see. Now, quick question. Can you talk to them? There's another question, like, I mean, will they talk to you? Will they communicate with you? Yes. So in that case, so not really, they will not gonna, communicate with you. So another drawback in that, online, but it's become more easy. Like, if it's like you are a self-oriented person, you don't like to socialize more, than maybe online based exam is nice for you, actually. Okay. We targeted, I mean, I'll tell about our academy. Our academy, we targeted the online swan more actually, because of certain reason. In coming days we'll tell you actually. Yeah. But the center base, we equally have good results on the thing, but when the online came, we targeted the online more actually, yeah. So that's just why. We'll tell you those things later. Okay. Now, examiner's role, just sell. I mean, here is no such role on the examiner. He'll just be there to monitor you silently from the side. How to manage time. Now, can you have a watch with you? Or will you have a timer in the screen? I'm talking about an online based exam. Will you have a timer on the side corner? Now, first of all, you are not allowed to wear any watch, even in Melbourne exam, even in, that is the security check. So you're not allowed to have any clock or watch or anything in your room, right? That is the thing. But let me tell you a secret here. What is that? Okay, this type of lot of secrets will tell you in coming days. See, you see the computer screen and all this thing. Your computer also has, clock and all this thing, and that probably they cannot always see, right? They can see everything, but they cannot see, your screen and all these things actually, many
Actually,
cases.
doctor,
So initially they would.
the program they're working on for the exam, doctor, they are putting a screen which they completely cover everything. You will not be seeing a watch even, unfortunately.
I'll tell you that one in someday actually. Yeah, usually it cannot be seen. Usually it cannot be seen. They usually take control, but I'll tell you, not like, because today is a more about a public class, but someday I'll tell you actually about that trick. Okay, no worries. Yeah, but anyways, it's more about things related to practice. It's more about a thing related to practice. I'll tell you about that trick. How to get a watch actually. Don't worry about that one. Yeah. I'll tell you the trick. Yeah, don't worry. It's a today we're taking the public one, so let's not get there. Yeah, so we could be in trouble. Yeah, but I'll tell you the trick someday. Yeah, but anyways, how to manage time, that's more important, and that will be my role to guide you in coming days. How to manage your time, how to overall manage your time. Yeah. Okay. Now the last question: effect on the passing rate. Uh, Overall passing rate hasn't much changed, after the online based game. All right, that's the thing. But my opinion, actually, people didn't utilize it properly. Could have taken more chances with online exam. See, whole physical examination is almost cut off. You just need to memorize the physical examination points. So you could have done much more, because a lot of people failed in the physical examination in center base. So People didn't take advantage of the online exam, but we managed to take a lot of advantage with that online based exam actually. So we'll try to add more things. So for us, it was going like, as I mentioned, like 75%. So we are very happy with that online exam format things. Anyway, so these are certain changes, more changes when we'll do some role play. You will also see, how it looks like actually. Okay. Now, passing for formatting of the exam, passing is sorry about the, I just need to change the number. It's like has to be at least 10 out of 14, so that's some of the things actually. So at least has to be 10 out of this 14 actually. So, two of them counted as a pilot station, so those are the things like the MC2 actually. So your result are always given. Sometimes you'll see 14 by 13. Like very recently, one doctor passed, she was from our academy. She passed like 14 by 14. All right. Previously, one doctor also did 14 by 14. There's another one did very recently, actually. All right. So that's great. Feel great. Like, so you can see that's achievable, right? Even 14 by 14 is achievable, actually. All right. So, I always tell one thing, target better, target more, so that, the failing thing doesn't come to you much actually. Like, you should be targeting like 13 station to pass. You should not be targeting, okay, I wish I could pass just 10 station. No, it should not be the plan. You should be targeting that, like, I'll pass like, 14 by 14 or 13 by 14. Okay. So you should prepare yourself in that way, it is possible. Usually result publish, different time it changes. Usually in 2 weeks the result came up, but lastly we've seen it was taking a month actually. So what's the current state now? I mean, some doctor can tell, but previously it was always like a 14 days actually. Is it still the 14 days? I mean, because previously, very recently, it was changed it was taking a month actually to publish the. In MC1, it takes a month. In MC2, it takes 14 days. All right. So that's the thing. Okay. Now, quick question. What will happen after, you know, um, great. So what will happen after appearing MC clinical? Now, this is interesting. Now, pass, fail, of course, and retest. Now, is there any retest any longer available? I mean, retest means they used to take half station test previously. So that is for last, I think 2 years, they have cut it off actually. Okay, now you are also considered pass or fail. Guys, if you have any question, you can drop in the comment section. I'll be definitely answer you back. Okay, so retest, they used to use actually, but still, you have to face an exam. Okay, this is a center, main center. Even if you see my YouTube channel, I make a video on, when I went for exam, like I made a video that, see like, the center. Great. Okay. Now let's take you to the exam center and little animation, all these things. Yeah, ignore that. So thing is here, if we talk about the main center, this is how it looks like. This has been taken from the MC website. Yeah. All right. Some doctor asked, do you have to take the whole, your total station is 16 station, my dear doctor, overall, actually. If you fail, you have to take all the 16 station. No, not selected subjects only. It is not possible now. Okay. You have to take the whole exam again with the similar amount of fees again. Previously, there was a retest, half a station, and also money was also like half. It was like that actually, but you have to face the exam. It was there like that, but it was complicated, so they have removed it eventually. Now, if you see, this is taken from the MC website. This is how actually it looks like. So you see, there is a monitor, there is a door. So you have to stand here. So you can see these particular things for standing. So candidate has to stand here. When there will be some kind of sound will come, you have to enter. Before that, you will get to see your question in the monitor actually. And when the time will finish, you will come out and enter into the next room actually. All right, everyone clear? So this is about this particular rotations. You see, there is like 20 rooms. there is like 20 rooms, and this is how the rotation will happen. One room to another, one room to another. And so there will be some people here also to guide you at the same time, right? All right. So 2 minute, 8 minute, all the game is related to that. All right. Or no worries. So we'll be also guiding you with physical examination. So don't worry about that. Okay, we'll provide you the recordings. Don't worry. Okay, so note material, live class, role play, physical examination. Oh no, these are the now certain things, materials like some old materials like handbook, Karen notes, Marwan notes, some old materials. People used to use them as a 5-star. Still, people use it. I mean, when they start, they just keep reading thoroughly. But currently, we say that's a wrong idea. It's better you read the recent notes. Actually, that's better. Actually, even Karen used to be almost 8 years old note. Handbook used to be still it's quite a good standard, but trust me one thing, MC handbook, um, how it is written, it's not at all similar in the exam. Actually, that will give you an idea, but it is no longer at all same, how you have to tell in the main exam. Actually, so what to do in that case, it's better you read any institutional notes. Actually, would be better, or updated note. Actually, we have been recently updated again, and so it's been updated till 2022, so it's better you read the latest notes. Actually, that's better, and things are coincide to the point. Actually, it's better, not like a too descriptive. Like handbook, as I said, the words are nice, but too descriptive. You don't get that much of time to, finish a case. They talk about everything. So if there is a torsion of the test is, they talk about everything. But in main exam, it came as like a 3 or 4 stems. What is that? I'm going to tell you, shortly. This is physical examination books and all these things. We have our own notes on physical examination. You can also follow that, but most of the doctors, even when we were preparing, we were also following the Tally and O'Connor. Actually, it's good actually. But personally, I was also using the Maclauds because I was familiar with Maclauds a lot. All right. So any book, if you're familiar with, you should also have that one. But you can also look things from Tally O'Connor. Also, you can use our physical examination notes actually. Right. Next thing, clinical exam guide, handbook cases by SMA, many of the other things, these are the PDFs which we provided and put in our drive. So which just showing the link actually. All right. So now the priority, exclusive things. First priority to finish our notes. If you're not joining, keep finishing at least one case a day, like one video. I mean, half of a one video or 1/3 of a one video for a one case, and at least finish a file. In that way, at least you can recharge yourself before joining the live. That's can be another way. Recall notes, class recordings, physical examination guidelines, MC handbook system wise. It's better to cover as like an MC1 we used to do. All right. So, and don't worry, we'll help you in many ways actually. All right. Here is a exclusive thing. We usually organize this particular things like in our MC. Uh, Apart from me, there's like Dr. Limonte classes. He's already an RMO in Elizabeth Hospital, so he take classes, and Dr. Koishi take classes, and she's also senior RMO. So that's the thing. So that's how the things are. So we usually appoint only the doctors who have been working, because they can provide you the latest guideline, and also the job hunt session. They also take part on that one, and you can be also keep in touch with them, especially in terms of the job hunting session. So we have a very nice job hunting session regarding that. So you'll get time to prepare. So usually we take 2 job hunting session, one probably in early phase and one will be a little later phase actually, so that you can come up with questions later actually. So that will be not today, of course, that will be a separate session. Yeah, no worries actually. Great. One uh, common video, what to do after MC1, that I have already posted in my YouTube channel. You can check that one. That's a superficial video, but every individual topic like CV, cover letter, the job website links and things, that's probably a bit different actually, so which we usually cover in MC2. That video usually we don't post in the, because of some sensitive issues, we have to show some format CV and things. So that's why we cannot release those videos actually. So we keep it to our MC2 actually. We're not in MC1. All right. Classes, of course, in 4 months, Saturday, Tuesday, 2 classes. These are the timings of the classes. So theory, reconstructed cases, recognizing notes, materials. Has like a lot similarity with MC1, you'll find. All right, great. Now, let me little demonstrate to you with certain things now. I'll take over the screen for a second. We'll be back, guys. All right. I hope you can see our screen now. Please confirm me if you can see our screen. All right. So first of all, just giving you a little demonstration on the things, if you are from our MC1, you already know this probably for some of the new doctors, but also our MC1 doctors will also get idea how things looks like. The first of all, the content, what are the resources, what are the books needed, what are the, the basic contents actually. So it is of course like related to ebooks, few of the things I put as a 5-star, but don't go with it. 5-star is the notes actually, which you need to finish. But people also use them as a 5-star content, like Karen notes, MC handbook, and Marwan note. But still, till date, handbook is quite a gold standard. Everyone finish it actually. But we focus on finishing it in system wise actually. So MC handbook cases system wise, that's more better. There's another extra book, John Murtak Patient Education. Previously, we never used to use it. John Murtak has 3 books, to be honest. One, the main one, which I taught you, many of you. But there is another one, John Murtak Patient Education. Okay, so this one has a lot of, like inquiry question, counseling things, what is in patient's mind. Because see, there is a section that you have to answer. There's a section you have to answer the patient's inquiries. Your passing also depends on patient's inquiries. Okay, so this book may help you in that one. Right. Also in the classes, we'll also tell you when we do a role play on things, we also tell what are the else type of courses. I mean, questions can be. Next is, some of the physical examination book, yeah, that's the thing. Yeah. Yeah, let me know. Yeah, thank you, Dr. Abdullah. If you know like any good counseling book or any good book, feel free to inbox me the name and the things. If anything I can contribute for the doctors will be very helpful. Yes, no worries. Another one is a open for all. Actually, that is the Greeky Medics. You heard this name, dear doctors, the Greeky Medics. Yeah, they also have some nice physical examinations actually, but keep it in mind their physical examination are almost like 15 minutes. So it's more like a USMLE type. Okay, but you'll get an idea, how to say peripheral vascular disease, Burgess disease, how to examine on point. So all those things are nicely given actually. So if you haven't, you can please subscribe to Greek Emetics. Very useful. Yeah, and you can just check it actually. Very standard. I would say very standard actually. Very nice way they had come up with those videos actually. Now books, I mean physical and PE means physical examination. I organize in that way. All right, so extra, some of the 5-stars. 5-star also includes mainly our notes actually that I will show you shortly. This is extra, like, just organizing that way. P means physical examination. All the books are here. And also physical examination total list, like they're like a almost 50 or 60 list. So one by one, you need to finish them. Now, if we click them, let's just show, or like, yeah. So this is like physical examination, like the list and all these things. So it goes on more things. So this is like the list actually, and we update the list as well actually. No worries on that one. If there's a new thing came up, we'll update it again actually in 2023. No worries. Now some OSCE guide, I maybe this book you are talking about, this OSCE guide book actually, maybe, and useful some DD mnemonics. Yeah, so anyways guys, so these are some of the ideas related to in general content. I mean, everyone has this kind of contents probably. Now come up the things like, let's say physical examination. Okay, so physical examination is in this way. If you can see, uh, overall. So there's like a 5 notes and 5 sessions to cover the physical examination. There could be 1-2 more addition in coming days. No worries on that actually. All right. Then comes, let's say, you enter into pediatric folder actually. It's example. Like this is how, I mean, I just finished the alpha 5 actually. This is how it's given actually. All right. Now you see the pediatric, probably class 1. I mean, if we just click, okay, so this one probably we're taking now. And another things like more focusing on the history and things, formatting and things are given here, as you all can see. So more with the history related things. So the first class, mostly we focus on the format. Second class, we focus on the history taking, because history taking is art, right? So it's very, very important. And of course, the relevant videos and the things how we covered. Then on that, so see childhood rash, like a lot of like, when I will take the class, it will show more animations and the things, but now I'm showing the PDF. This is how the PDF things looks like. You can see the notes quality and colorful. I mean, it's best in the business, definitely, in terms of the notes. In our AMC one, we also added notes, and that's become very super hit nowadays. All right, so we focus more on notes because it's a very normal thing, any doctor, any student, anyone, so let me know in the comments, do you like to read nice notes or not actually? So do let me know in the comment section, do you like to read nice notes? And these are very basic things. I think everyone likes little concise and organized notes. And if it is little colorful, like you see this, of course, this is way colorful, actually, things that, so pediatric cluster, pediatric notes, history taking, role play, and all main points we do highlight actually in that way. So this is how things looks like, as you all can see, the important point, we concise things and we highlight main points. When you see the video, you'll understand why I mark this one, why I mark this one, why I put this red, admit hospital as a red. All right, so these are the certain things. Now, this is like the thing I was talking about, case description, what patient might ask you, like, is it meningitis? What is meningitis? Can it be leukemia? These are some of the patient's questions actually. All right, so keep it in mind when we'll do more things. A very sick kid, very popular in the exam. So this is how like the notes and things looks like. Okay, so you see for pediatrics, so many sessions we conducted earlier. Then there is like medicine. Yeah, so a lot of contents in medicine. This time we may add one more additional with the medicine. Then this is obstetrics, same thing. Then about the obstetrics, there is gynae. Gynae ops, usually taken by Dr. Qureshi most cases. She's good with that. I personally don't like gynae much, to be honest. All right, then there is surgery. As you all can see, surgical things are here. Let's just click on them. All right, yeah. Yeah. So anyways, I mean, this is the idea, like, how things looks like. Yeah. Right, in the contents and in terms of everything. So things are organized, notes just getting better and better. I keep working on the notes actually, the notes 1 year back, way different now actually, because I keep updating. Even in MC1, we keep updating. Those of you recently came through our notes before exam, they were helpful actually. So as a tutor, as a teacher, we have to think in that way that I just make content and I just relax. That should not be the thing. I need to keep working on the things and improvise it. Most people, they follow, I mean, MC side, like get copied all the time. I don't mind. Most are my students. I proud of them that they're also doing well. Yeah, not a matter actually. Yeah. So good wishes to all of you, and let us get back to our section. Just give me a second. Let me share that video again. Just taking a second. I'll be sharing the video. Yep. Okay. So guys, did you like the demonstration of like the how contents looks like, how the materials looks like? Did you like the demonstration? Okay. I mean, is it clear? I mean to say, do you like or not? Or I mean, was it clear? Like, how contents and books, did you get some idea? Did you get some idea? Like contents, books, notes, plans. Now, guys, my request and one to true stories here. You know, see, as a teacher, I also have expectation. As a student, you also have expectation. Now, some of the doctors after MC1, they got biased a lot actually. And think what happens, there's a time they want to relax. I understand that there was a time period of probably 8 months, 1 year, you were studying a lot. But at the same time, if you try to relax too much and say just for English test, you are considering 3 months. Um, see your flow, you started losing. Then so many doctors they do. I'll tell you two scenario here. Scenario one from one of the doctor, good student. I told her that you don't have much experience. You should just start MC2 and all this thing. But she did. um, that okay, so she went for English test and it took like a one time she appeared, she failed, then she appeared again in weighty. Nowadays I don't much appreciate weighty has become changed and difficult, so PT is more easy, guys. So try PT. I mean, if minimal, if you're too bad with computer typing, then maybe not a best idea PT. Okay, but most cases PT I would say easy then OIT, because OIT has been changed a lot. Now she went for that weighty and it took like a 3 months. Then she remained a little silent for a while. She was trying maybe little job things and it didn't work. I told her very clearly, see, you just nearly have a 1 year, so it doesn't make much sense to me. Better you try with MC2. Then with MC2 you have 1 year, and MC2 you have more chances. Now she disappeared, didn't come, maybe went to some other academies. Then after maybe 1 year or 1.5 years, she messaged that she uh, couldn't cope up with the things and things doesn't goes well. She's not understanding a lot of things. And, it's moreover like, see, a lot of doctors, see, a lot of instructors are good in MC2, but the thing happens that, someone who, force you in study, I would tell this thing in that way that everyone is good as a instructor, but thing is, some people put more pressure on you, and this is how a lot of Asian culture works. That our teachers side, our teachers also used to put pressure on us on studying. Then we used to study a lot actually. But in Australia, if you go, no one will ask you, because people don't ask any personal thing. People don't tell you those kind of thing actually. They think that as a like Aussie, that you do your own things actually, but thing doesn't work in our way, right? I hope you understand what I mean. Actually, we need pressure. If there is pressure, then our engine works actually. That's how most cases in MC1 living example was that when I put pressure, that you guys study more actually. If I get angry sometime, you guys also study more actually. So some of these tricks works actually. It's not like in person. Those of you know me, I'm not angry person, but in class sometimes I get angry. It's because why you're not studying and this that. um, uh, then they started studying more seriously actually. This is sometimes part of tricks and the things actually. All right, so keep it in mind that you summary thing is here again. No matter you are in my academy, wherever you are going, it doesn't matter, but please finish it early. That's my request. Like in MC2, don't give a large break. So that's the scenario one. 1.5 year passed after MC1, couldn't even appear in MC2. Now telling, then I told that, what would have been that time you join, you finish just MC1 and could have been by this time, you could have been finished and even apply job with MC1 and could have been even having more experience. All right. So this few things, please keep it in mind. When teacher is telling something, must be knowing. And as I said, in MC2, we don't really focus on lot marketing actually. So very, very important. Please finish your MC2 early, because how long we can study, we get also frustrated at certain point of time, so that's the thing. That so lot people also have seen, they stopped studying, because maybe took long time, then they appear, then probably they get fail, and they stop studying MC2. They stop their MC journey. Some people also get busy with family. We understand that, especially in case of female, they have more probably responsibility with kids, some cases. So people get busy with time. So guys, this is a good chance that, you finish up and wrap up things quickly. Very, very important, guys. Uh, don't go in that pathway. Like, like wrap up the things with me, without me, doesn't matter, but wrap up the things more quickly. That's very, very important. I'm telling you again. All right. Now, live demonstration on material gone, and we already told like what materials. Yeah, idea given. And when you give, as like some people, in MC1 we have course T, here we also have course T. Will be given all the things together. You can also study and of your own. That's also okay. Very reasonable and the things, so you can always take it actually. All right, so pediatrics, history taking, resources, cases. Let's just see a little bit. Okay, few secrets. Okay, like let's see. I mean, few secrets. What does it we mean by secrets actually? Okay, lack of interpersonal skill. Now, this part is related to. It may vary. See, someone may be from Bangladesh or maybe from Sri Lanka. I'm just taking names. I mean, randomly. Maybe some cases, some of them don't talk in English too often. So in that case, like, some of the interpersonal skill may not have developed, because when you go to the Australian centers, or even if you do the role play, they all are Aussie role players mostly. Their accents is very much like Australian. All right. All right. So if it's like very much Australian accents, you need to be familiar. So if you never live in Australia and you directly first time appear in exam, many time the dear doctors, they don't understand. Can you repeat it? I'm sorry. Can you repeat? Now they also think your understanding power is not that good. Now those of you who are living in Australia, my dear, have this benefit here. You can understand their words more clearly. All right. Do you agree with this thing that the Aussie, many of the Aussie has a different accents? Do you really agree on that? Like maybe I'm talking, you are understanding quite easily because I'm from Asian background. Maybe a little Asian accents maybe also there, but more probably it is understandable. But some cases their accents, not everyone, but some of the people, their accents is so different, right? And some of the role players would be there like that, right? So please keep it in mind in that way that things, it can be in that way that if you've never been to Australia, some cases this kind of thing it can be. All right, so some cases difficult to pick up. So if it is for the very first time, if you're doing it, it can be an issue. So in order to tackle this problem, this time I will invite, Intasar is on one of my student of MC1 too, but he's a Aussie at the same time. And he's working right now, in Australia as well. So I will invite him in some of the sessions because so that, you can do some of the role play with him actually, because his accents is the pure Aussie accents actually. All right. So it is very, very important, guys, that, you should be at least exposed with a Aussie person actually. You understand what I mean actually? That Aussie person means Aussie accents actually. It has to be an Aussie accents at least. That
Yeah, and they do
because
have a
their way
kind
of
of a
talking
slang
and
language. So basically, you
yeah,
need
yeah,
to
yeah,
understand that
yeah.
Aussie.
They do have.
Aussie,
Yeah,
that's a
yeah,
very
yeah.
important.
Yeah, you
And
you live
sometimes,
there, so you know those
yeah,
small
obviously,
things.
because
Yeah.
they use the various slang language, and you need to understand some of the basic words actually what to speak.
Sometimes even the whole sentence meaning is different.
Yeah,
Sometimes even they
yeah,
use
it's a whole
like example, that's not my cup of tea. I mean, who will understand that's not a cup of tea or this kind of thing?
yeah.
Or many, there's proverbs and the things are there actually. Yeah. So probably I'll invite Intasar maybe one or two session. Because he has gone through the MC, so he can tell you the exact things in terms of those some of the extra things, especially not for like people like you, because Dr. Intasar, you lived in Australia, so you know these things, but those never been to Australia, never talked to the Aussie people, like, because it can be quite a different. Yeah. And one time, when I was in Australia, that I used to meet Intasar very often. So he was telling a lot of things which I also never knew. This kind of words even present actually. So I used to tell them, yeah, oh, so this is present. Oh, what? Yeah. So this is like, but they will use those words in the exam. So then, you have to, "Oh, I'm sorry. And there will be a lot of trouble. But the main point is actually to understand very clearly. If you don't understand clearly, there'll be time is going actually. Right. And some cases, if you don't understand, you talk about something different and that will be cut off your mark. That's the most dangerous thing in that case. Okay. Great. So lack of interpersonal skill is not only about the English, it about the accents, it about the Aussie culture, how they talk, how they behave, and also some of the, the rapport development. Now, improper history taking, a lot of people take 4-5 minutes just on the history. Okay. And some cases, even I was doing a role play, one doctor, I checked like, 6 minutes passed and, still in the history. Okay. So, that has to be cut off. But initially it's fine. Like, when very first, when you will start, that is okay. Like, because you are just learning, how to do a case actually. So initially we don't mind, but gradually, I'll start getting angry probably. I know why you're taking 10 minutes now, for that one. Great. Time management, with the more time passes, I can guarantee you your things will be fine. And that is the reason you should have one or two study partner and regularly do time management practice, a very common thing in Australian, all we practice. We are also, told by people that do in that way. Normally it is 8 minutes, so cut off 1 minute, practice in 7 minutes. So this is a very, old theory. Many people used to use this one, but a lot of things I will tell you, that's not the way. To be honest, time management can be done. There is certain words and role play where you can save time, especially in the history part, actually how to cut short the history. So that's the thing. If you are going with the proper history as it, if it is given, you will be in real trouble actually. So which part to cut short and in which cases which part to cut short, that is very important actually. Another thing, fail to realize the case. I think Dr. Intasar would be agreed. Many time when we start a role play, many doctors start taking history, right? But history was not there even in the uh, question actually. When the question is displayed, it is also mentioned the task. Actually, task is a history taking task, is a probably ask about the physical examination finding and tell the diagnosis. So 2 or 3 step normally, or maybe it is given in that way that as the physical examination finding, diagnosis, DD, management. No history was mentioned, but the doctors start taking proper history. So fail to realize what is your case. If you do that, of course, your time will be cutting and they will also count that you didn't read your case properly. So you are again going to fail in that case. Lack of communication, actually. Now, interpersonal skill is the one thing that Aussie accents, Aussie thing, how you, because some people can be introvert. Yeah, that's the thing. And many are shy. I know that many are shy, when I'll start doing role play, many I call, okay, come for role play. No, doctor, I'll do the next day. You know, 1 day, 2 day, but if that keep happening, that means, it's not going well for you. So from now on, keep talking in English with your study partner, friends, whoever that's possible. Some of the doctors are very comfortable, maybe because in day-to-day life you also use it. All right. Um, Lack of knowledge. Yes. If you don't know your case well, of course, you're again going to fail. You will talk something abstract in that case. So you also need to give proper information regarding the case, actually. Now, another thing I put as a non-working doctor. I mean, first of all, I would say relax. I mean, don't be afraid on that one. I have a suggestion here as well. So non-working doctor means they are not exposed to physical examination nowadays much. But say if you are a medical, like teacher or something like that in a medicine department, still you are um, doing the physical examination. So it means that if you're not exposed to doing physical examination regularly, maybe you didn't do any physical examination in last 4 years, right? Many of me might be living in Australia and never do any physical examination in 4 years. So then it can be an issue in some cases. So from now on, it is high time you start doing physical examination if you are going the center-based exam. So there will be almost 3 stations on physical examination. And if you're not familiar, they will see your shake hand. Your hand is shaking while examining. Okay, don't expect that you can do a 7 days course like on physical examination and you will be expert. That's never gonna happen. So you have to start from now on if you want to pass and like very steady hand. Now here is a tip for those doctors: you better take online based exam in that case, because you really don't have to perform physical examination. Got my point? Isn't it a good tip? In that case, if you are not into medical practice for a long time, in that case, online based exam can be good. In that sense, you don't have to perform the physical examination, right? All good. But still you need to know those knowledges of physical examination, like which point after this, that. Yeah. And trust me, still the knowledge is, I have found, is not the same, who is working, who is not working, even online based exam, because in their mind it comes naturally. Okay, they can close eyes and they can tell easily that, because they have been performing it for many years. Okay, so this is one thing that goes, and we'll work on some of the interpersonal skill. No worries on that. Okay, now here is a little scenario. Let me give you idea. Okay, so what's that? In that case, uh, you can see the doorway. Next thing you can see, like, there's like history taking. There's like a physical examination. There's like closure of the case. And you see the in the doorway, as you all can see, I mean, when you stand in a doorway, you should also consider that what should do in that 2 minutes, right? To be honest, this is, I would say, a golden time. This is, I would say, a golden time for all of you, right? In that 2 minute, you need to process that whole case in your mind and start organizing it. That, okay, it is this point, it is this point, I will not miss it. Okay, if you can organize it, I mean, personally, when you enter, you will be like, like very good. But if you're like thinking, okay, in these 2 minutes, I'll just read this question and that's all. No, I mean, you need to, in first 10-15 seconds, you need to make a diagnosis in your mind. First 10 to 15 seconds, you need to make a diagnosis in your mind and start processing. Say, if it is a pyloric stenosis, okay, it will be vomiting, it will be projectile vomiting, it will be baby remain hungry after the vomit. Uh, okay, I'll cross difference with the ZERT. I'll make the hydration clear. See, in 2 minutes, I can process everything, the key points. All right. All right. So that's the thing, right? So this is something, you need to be careful, and especially in the doorway, in the 2 minute, you need to be, careful, actually, all these things. All right. Next coming is the history taking, which over the next 4-5 months, I'll tell you more about the history taking. I mean, initially, probably in the next class, we'll be discussing the history format, how to do, and I'll do practice with 1-2 of you guys. You guys are all invited again in the next class. Then the physical exam. Now, physical examination form is of two types. One, physical examination proper. One is a PEFE. Now, my quick question, what is PEFE?
Physical examination findings from the examiner.
From the examiner, yes. All right, so this is from the examiner, actually, physical examination finding to the examiner. Now, quick question, is this PEFE applicable in online exam? My quick question. If we do a compare contrast, is physical examination PEFE is applicable for online exam?
They'll give it in a slide straight away. You won't be asking
Yeah,
the
it will be
examiner.
this. Yeah, because examiner is silent here. So you will not get into that. Rather, you will get a slide, actually, of physical examination finding. You'll get a total slide or a prompt on the physical examination finding. Okay, so this is another big difference here. So physical examination proper, for the main exam, you have to enter, perform physical examination, give a running commentary. We'll show you that in next class, don't worry. And finally, closure. Now, closure includes a lot of things. You finish properly, you tell the treatment and follow up if it is required. Okay, some cases they don't ask management, so you don't have to tell management. And also thanking the patient. If you expose the patient, then in that case, close things properly. And if you can summarize, like, so we have gone through all these things, little shortly. We have come across all this thing, we've done this thing, and this is your diagnosis. Do you have any other question to ask actually before I left? Okay, so that's called a proper closure actually. If you can get up to that point, you have marks for that actually. Every single individual areas has marks, which I will tell you time to time actually. In next class, you will get to know more about these things. All right. All right, that's social lemon actually. But anyways, most MC students feel they have issues with time management. It is 100% true, I think. So individually, I mean, we'll do more role play. Things will be fine with time actually. All right, Limon will tell you more about like things. Don't worry. All right. We'll talk about, like, not in this way. You should go to exam hall. We'll talk about this kind of interesting things. How to dress up, how to do all this sort of things. So don't worry about that actually. All right. Guys, I haven't taken the question yet because I'm reading slides now. We'll see those things a little later. All right. Now, next thing, after doorway, when we enter, there's few things that come up actually before starting the case actually. MC clinical, before start, I mean, you should always look into the vitals actually. If vitally unstable, you should try to take them to the, emergency cubicle. All right. So there's a way of telling all those things. We'll tell you that one. Like, if it is shows that patient's vital is not stable or unstable vitals. So in that case, you have to tell to the in front of examiner that we like to take the patient to the emergency cubicle, give IV fluid and resuscitate. Is my patient is doing well now? Examiner will tell is doing well. All right. This is in the main center-based exam because examiner is with you in that case. Great. So there's some way of telling, which you need to memorize. Now, quick question. What do you think, guys? Shake hands, is it necessary in MC2 exam? What do you think? This is few small things, because you must have seen in some videos, like, someone is entering, someone is doing handshake. Is it a necessary thing always? Answer is a no, it's not necessary. And there was a COVID period and it was even restricted, the handshake actually. It was mentioned that you don't have to do handshake in that case. All right, so that was important. So it really doesn't matter actually. And patient, some cases may not handshake with you, like maybe a sad patient, depressed patient. Okay, after the doorway, meet and greet the examiner. Okay, show your ID and if those things applicable. Do you understand your case? Yes, examiner, you can proceed. Examiner, examinee, thank you. Right. So in a nutshell, ID check and all this thing. Yes, so there's a bottle would be there, so you can do the sanitize of your hand and all this thing. Yes. So introduction after the handshake. Yeah. Start with the open question. Hey, I'm Sharir, one of the GP in this clinic. What brings you today in this hospital? I mean, unless if it's a very sad case, don't be so happy and tell. In that case, you should make a sad face as well, probably. If you're already mentioned patient depressed. So, hey, Melissa, I'm Sharir, one of the doctor in this GP clinic. And I can see from the notes, you're not feeling well. How can I help you, dear? Yeah. So these are way. Do you know, in those countries, hey love, how are you? This that way they also talk. Do you know this? But you must be thinking, why he's using this word love. But it's sometimes a very common gesture. Hey love, how are you doing today? Yeah. So this is normal things actually. And hey, you can tell me what brings you today in this clinic actually. So please make sure the patient is not a sad patient in that case. Otherwise, you go with a smile and all this thing, as like in this photo, would be really nice actually. One more very important thing, always check your position from the question. Are you a GP or you're a RMO? Please check it from the question. Yeah. We'll talk about the sticky notes makes. Some of you may have idea. If you're from MC1, we encourage doing this thing. Some people also upload very nice pictures, like, their whole wall being scattered. I mean, full of sticky notes. If you are doing that, now is again time to do in MC2. Yeah. So summary here: doorway 2 minute, after doorway mid-grade examiners sanitize, introduce open-ended question starting with better allow the patient to talk his points. If you just cut off in the beginning, patient may not give you some vital information. Then history taking in proper, build up communication rapport, then come up with physical examination, investigation, diagnosis, DD, all these things. Okay, let's get into that second part. All right. Okay, so let's not take break. Let's continue. Okay. Do you know? Okay, that's now interesting question. Do you know the passing rate for MC clinical?
5 to
Okay.
20.
According to the website and the things, it's like 20%. Okay. Do you know the passing rate in PLAB2 exam? Just for knowledge and idea. Do you know the passing rate in PLAB2 exam? Okay. In PLAB2 exam, the passing rate is approximately 40%. Okay, so almost like double. Do you have any idea how it is in USMLE step 2 CS? Now it's been cut off USMLE step 2 recently, but do you have idea? I mean, USMLE step 2 passing. I mean the CS part actually. Answer near to 50%. All right. So the thing is now because they're getting almost 15 minutes approximately. They come with a history sheet and all these things. So time that matters. See, what do you think? NZRS exam, which is a New Zealand based exam, what do you think the passing rate is? NZRS itself is a clinical exam. I mean, a quick thing, is it more than MC2 or is it less than MC2? You must be heard about NZRX. I mean, those are in New Zealand, they try for that one after MC1. You can also try even. It is more than MC2. Why? The reason is they got 10 minutes. You got 8 minutes. Clear now? You imagine if you are added 2 minutes more to your case, you could have done well. So very simple as that. Yeah. So the time frame is an USMLE has almost 15 minutes. So again, the time frame. So guys, time management, time frame that matters. 8 minutes, you will feel quite less. And you need to know the skills, how to manage. Task to perform in MC clinical. All right. Now, here is the thing about the task. You see, I divided into a lot of components like approach. These are the things you have been given marks: approach, physical examination, investigation, diagnosis, DD, management or counseling. So 5 segment. My quick question is, all 5 segment do you have to cover in a MC part 2 exam?
According to the task.
According to the task. And how about the most of the task? Does they have 5 segments or most cases 3 or 4 segments? So most cases we got 3 to 4 segment. That means you will be given approach, physical examination, investigation up to diagnosis. Maybe the management is skipped, or the approach or history is skipped, and physical examination, investigation, diagnosis, and management. Some cases even maybe cut short: investigation, diagnosis, and counseling. Counseling's individually is big. So you have to check probably, guys. This is another area where many people make a mistake. They don't see their task properly. They say, okay, child with vomiting. Okay, I think pyloric stenosis. But please check, whether you're offered to ask history or not, because some cases questions. Now, here is a small tip. If question is little longer, the scenario is little longer, do you think you have to take history or you don't have to probably take history? If you think the question looks little longer, probably this question does not require to take any history. Okay, so get this type of small clues I will tell you in time to time. So if little longer question means, you probably don't have to take history, but of course we'll check it properly. Okay, and a feedback format, yeah, of course, very important. We'll give you a lot of feedback format. Important to know the receive feedback of the exam plan and to execute properly. All right. Now, this is how the feedback analysis is given. This is how the result is given. Actually, this is one of the result. I mean, I just process it. It was given marks out of 7 actually. So 7, 7, 7, 7. Okay, so how much to get? Minimum, how much to get out of 7 in individual segment, guys? In any idea? Individual this segment, what marks at least to get? At least 4, roughly. Yeah. So at least 4 roughly. Now, if I say 4, 4, 4, 3, what do you think? Are you going to pass? 4, 4, 4, 3. Are you going to pass? Answer is a no. Say you got 5, 4, 5, 3. Are you going to pass? Again, are you going to pass? Again, it is a no. So individual every segment you also need to give. So if you're only focusing on the history, how come they can give you pass? Rather than by the time you come to the management, you're not telling about the basic managements properly because you are lacking short of time. So you understand, guys, individual segment you also need to work on. Individual segment you also need to work on properly. All right. So don't just waste all the time in the history because individual segment has marks. All right. So this is the thing. Now there is another point which is called global scoring. Now, if you get like 4, 4, maybe a 5 and a 3, if examiner thinks your overall presentation was very good and you didn't make any gross mistake, they can give you pass on the basis of global scoring. Previously, one thing was applicable. It is called, critical error. Some cases it is also applicable, kind of like hidden. That say, if you fail to examine the pulse in a Burgess disease, do you think you are supposed to pass? If you fail to examine the pulse, like in a peripheral vascular disease or Burgess disease, there's no way you can pass. This is a critical error or a gross error. Still, it's applicable, but it's like a hidden. Previously, there was a list of critical error. If you do that mistake, you're fail, obviously. Now they put that one as a global scoring. I don't want to make it more complicated now. Actually, we'll talk about global scoring, critical error things later, actually. But for now, keep it in mind that you have to equally do well on individual segment. Are we clear with that one? At least we have to perform well on individual segments that, both if it is a history, if it is a physical examination, an investigation, and the diagnosis, individual, you have to do well. That's the main thing. This is how score sheet looks like. See, it's like a station 11. All right. So station 11, it's a pass. You see approach, choice of technique, because it's a knee examination, choice and technique. So domain is score 5 out of 7, it is counted. Accuracy of examination 5, diagnosis TT 5. It's a clear pass case. Okay, you can see one thing, the green is passing. So if you reach 4, it's almost pass actually. So almost with a good grade, the doctor passed. And how long it is given? So 1, 0, 1, 2, 3, 4, 5, 6, 7. So the maximum limit, it can be 7 in individual segment, but minimum you have to get is 4. So 4, 5, 4, 5. If that is there, it's better. I would say you should target 5 or 6 individual areas. Keep doing it till it get better and better. Right? Okay, guys, let's hold here for a second. Are you guys getting the idea how the result feedback looks like? Please let me know in the comment section, guys. Is it understandable? I'm trying to give you a clear view. It's very important you get a clear view of the exam hall, the result, how it is done, in what area they actually examine you. Okay, there is also examiner sheet. Someday I will show you also that. how the examiner, when they're sitting, what they have in front of them. Someday I will also show you that actually, so that you get even more clear view actually. But for that one, I need to educate you first. Now, educate you means, coach you, on that, some of the cases and the thing. Then if I show you the examiner sheet, then you will understand, because that's much more complicated. Okay, online format. Yeah, so there is a thing, we call like prompt that's applicable. Yeah, already I think we told quite similar, but there were some changes, especially um, examiner does not have really much things. Yeah, already we told about these things, right? So do you want me to repeat it again? I think I told it already, guys. Yes, that is absolutely correct, Dr. Shar Abdullah. That's like, give the individual segment its respect actually. But because normally when we go to a patient, naturally our history taking is more important, because we are up to making diagnosis. So history taking can be a little bit more, but not like a everything. That's we need to be careful now. All right. All right. Maybe not today. Exclusive video. It will be too long. Then, how to save time. I will do a demonstration someday. Not today, actually. Maybe I can call in the sir next day. Let's see where he is. Yeah. So, since he's Aussie, I think like it will be fun also to talk to him. Yeah. Great. Now, some of the pediatrics history taking, guys. Again, the same thing. You see opening statement, history taking. History taking, say, imagine the pain, imagine the mnemonic Socrates. So those points you need to touch, and came up with some, key findings. Yeah, see Socrates. And some additional things like, do you have an associated feature like fever, vomiting, and all these things? If it is relatable with the case, actually, see, there is so many symptoms, but not all are relatable. So associated symptom, ask him accordingly. Yes. Then comes the other parts like past history. If it is a pediatric, like there will be birth history, developmental history, immunization history, then there's family history. As I said, our next day class would be more based on the history taking related things. Then there is the social history. I'll show you also mnemonic next day, how to cut off this, but it may look more complicated now, but there will be some mnemonic. Anyone remember some of the previous batch, like, what was those mnemonic? I think topes and binds were those mnemonics. Actually, I'll show you. What do you
Yeah.
mean by topes and
Binds
binds?
basically birth, immunization, nutrition, development, and the social
Yeah,
activity.
binds. Yeah, that's correct. All right. Well done, actually. All right. So binds and tops, right? These are the two things, we usually use actually for quick, because it's all about saving time. All right. Other system, there's systematic physical examination. We also have to check in some cases, like few of the things we brought because we have to bring it, but it's not always how we talk in the exam. All right. So before start, of course, we need your commitments. Be active, study well, do regular role play, make your own notes, even though notes should be given. But if it is possible, you make your own sticky notes attached in your wall, all this thing. Approximately minimum, it should be 6 months. Not the course will be finished in 4 months. That's okay. But um, for you, I think you should be thinking at least 6 months for preparation, 6 to 8 months. Actually, we're not in too hurry, right? Um, finishing in one go is the main motive here. Actually, also keep doing the physical examination. Yeah, like record your role play. Some cases you can also send us your recording of role play. We can comment on that, no problem. Yeah, sleep well. Not sleep less. I think sleep well, but some people sleep like 9, 10 hours. That's not applicable actually. So if you are like that, please sleep less actually. It's high time to work hard again. Okay, talking about the history part, already we showed the history format, but when you get into the notes section and in next day more In the beginning, hemodynamic instability, then comes the presenting illness. I'm just skipping now, not getting because people might be tired, including me. Then associated symptom, all these things, additional like rash, because something important should not be missed. In kids is a rash, can be a meningitis. Yeah. So things like that. All right. And cough, vomiting, stool, anything which is present, we'll ask this thing. If cough present, we'll ask this. If vomiting present, we ask this. Stool present, we ask this. All right. So yeah, great. For child, few things are important. The behavior of the child, feeding well or not, very important question. Hydration maintained or not, weight. I mean, what do you think about the weight, reduced or the same like before, in recent contact with anyone? Also, we ask travel history, and very important, two mnemonics, TOPS and the binds. TOPS and the binds. These are the some of the mnemonics. All right, keep it in mind actually. So those things, how to take history in very quick short time, maybe under a minute, or maybe in 30 seconds, I'll show you next day or maybe some other day. Past medical history, I mean, of course, family history, medical condition, those things we ask. And a few of the things, physical examination, again, a mnemonic, pickled. So the minimal thing which we ask is a pallor, icterus, which is jaundice, sinuses, clubbing, lymph node, edema, dehydration. I'll show you in coming days, how to take cut short. In fact, you don't have to ask the 24 points of physical, I mean, general examination, actually. We cut short the things, actually. All right, so we'll tell you. Office test related thing we'll tell you next day. There's a very few office tests. We do have to ask the office test. Like usually we ask in that way. The examiner, is there any office test available for me? Is there any growth chart available for me? Okay, these are the in general office tests. Some popular cluster from the pediatric zone, as you all can see. Yeah, more clusters. Now, which is the best way of study? Now, it depends. Now, many of you who came across MC1, what do you think is the best way you find in studying? I mean, reading the theory system wise, then gradually focusing more on recall, or getting directly onto the recall? I mean, okay, individual case, one can be from pediatrics, one can be from gynae, one can be from surgery. Yeah, so it can be like that. All right, so it's more fun. See, some of the study we should also enjoy. Like that can be also a good way, like recall, but you will not enjoy at certain point, right? And you will feel like my preparation is lacking. You'll feel like that. So please make sure that this is the thing actually, so these are the clusters. So every system when you start will show you the clusters. Like this is the way, okay, child with vomiting, what question to ask? Child with cough, what question to ask? Okay, and you become master of these things actually. So no matter in any way they ask you the question, you will just put into the format, all right, and go accordingly. And you will see, even if you don't know the diagnosis initially, things will become easy for you with time. All right, so this is something we'll be focusing more actually. All right, again, that history format things. Yeah. So if you see like pediatric, a lot of important points and things and out there. Yes, make sure you also read the handbook cases from the pediatrics. Yeah, this is how we'll give you demonstration. For example, pediatrics. These are the handbook pediatrics cases so far we noticed from handbook. So same thing in MC1, what we used to do, that while studying pediatrics, we'll target the handbook. No need to waste your time separately reading 2 months a handbook, while you can, while studying the pediatrics, which you can finish even in 2 days, then, or even in one day, these cases. After finishing our notes and the pediatrics you've gone through, then if you check the handbook, it will be just a 1 day thing or maybe a 2 day thing to finish these cases. Rather, in the beginning, you are fresh, you don't know how to even read AMC part 2 case, and you just keep reading like a descriptive and you are actually not getting it. So change the process of studying. Very wrong method. Whoever give you this advice, okay, read handbook and the things, they also been guided wrong. This is not the right way to start, because handbook is descriptive. You will not get anything unless you do a role play, unless actually the format. Handbook is not the format. Okay, handbook has written everything, okay, about a case. Okay, sequence to follow. Okay, these are the sequence to follow. Normally you see you will be given 3 or 4 segment, but normally sequence to follow: approach, history, physical examination, investigation, diagnosis, TD, management and counseling. Depends on what are the segments you are getting. Okay, but these are in general the maximum segments we have seen, including some of the stations are counseling stations. All right, so give respect to individual segment you are getting. If you're getting history, it doesn't mean that everything you have to ask from the history. All right, this is how a case looks like. All right, so task can be history, physical examination to examiner, or physical examination given in online in a separate slide in online based exam, investigation, DD. So these are the tasks, but not like a question. All right. Now in pediatrics, I'm just, before finishing, just giving you a little idea. Pediatric child with rash cases. These are the cases. These are the cases. So when you subscribe, you'll have those notes and all these things already. These are the cases, child with rash cases. These are the child with allergic cases we're going to cover. Pediatrics almost has like a 8-9 classes. Child with cough cases. Child with vomiting cases. Innocent murmur cases. Autism, a very recent case, otitis media. One will be miscellaneous. So if anything additional, so child abuse always comes in ethical situation, neonatal examination. So we also cross-check the any latest recalls and things that is attest or not. Any physical examination in pediatrics? Answer is a no, apart from just one case, which is called neonatal examination from head to toe. Neonatal examination from head to toe. Okay, so this is only the one case from pediatrics. Another quick question to give you an idea: is there any real patient in AMC exam hall? If you go to the Melbourne exam center, do you think you will be given any real patient? I mean, real patient means they have symptom or not. So they will not have symptom. They are method actors. They're good actors. Okay. And in terms of the child, will they give you any normal child as a patient? So answer is a no. No dummy or nothing as a child. They will never give you any child, because child, you can't instruct a child to act. Right. So that is the thing. So that is one of the reason. So how the cases comes is mostly the kid's mother or kid's father. They came with the complaint. Kid's mother or kid's father, they came with the complaint. Like Sarah's mom is sitting and Sarah is having this feature. Give your opinion on history, take proper history, do physical examination, and do investigation and make a diagnosis. This is how task would be given. Some cases they can also bring, say there was a case, croup, right? We call croup, some people say crop. So croup cases, they will show you just the sound, doctor, I recorded the sound, and they will show, let you listen to the sound. So some unusual things you will find. So physical examination, there was like 6 session, covered the physical examination. We have the both segment. One is the physical examination, face to face, and one is that, to med school students or online based actually. So depends on your exam, you'll get facilities of that particular type that is necessary. All right. So again, thank you. Recently they all cleared and many doing job. So hope you will do well. And now I'll check some questions here actually in our comment section and the things. Yes. Okay. One doctor asked a question. In between the station, is there any time gap? Oh, that particular 2 minute, my dear doctor. You understand what I mean? I mean, you have to go out and the next 2 minutes is for that next station. Okay, so if you delay too much going out, in that case, actually, it's a possibility that you may lose time. So this is like a when it started, it goes on actually. Yes, it depends. Now, this is one of the challenging part. MC Part 2 exam getting a date. Recently, there was date for the April. Actually, I remember April or May. Yeah, that was the thing. One question: is there any month which has more passing or failing in for the MC2 exam? Now, see, in MC1 we also don't answer this kind of question in open classes actually. So I'll deny that question for now. Okay.
I just have one question.
Sure,
In the
doctor.
exam, actually, how the role players, they speak up fast or they are very slow in speaking? That's a very important thing, because when you ask to think the
Both
history,
both
because
type. I found both
okay,
type.
okay,
Yeah, too slow I found as well. I mean, not cooperating at all actually. Those weeping patients actually,
yeah,
they start crying. Oh, like, it's like that. There's another group, what they're saying, you just have to keep him calm or keep her calm. Sorry, please tell me, talk to me. You'll feel like you will 100% fail that case. But interestingly, when you come out, you'll see you pass that case actually, because the whole time patient is not cooperating and they just want to put you in pressure actually. Okay, this is one
okay,
type of case. And one of the cases, the patient might speak a bit faster. I have seen that one as well, actually. Okay, so in that case, you can tell him, can you speak a little slow? It's okay, So just by in a smiling way, all right, just to make sure that, you are getting, I mean, usually they are cooperative until proven otherwise.
okay. Thank you.
Okay, any other question? Let me check.
Sorry, sir, can I just
Time
interrupt
gap.
you a minute?
No, sure, definitely. Now we
Yeah.
are open to questions.
Yeah, so in response to what Dr. Itendra Singh was asking, so I myself do a role play for the emergency medicine exam doctors in Melbourne Center. So I've been doing this for quite some years. So with me, usually, as you said, method, all of them are from the theatre students from Melbourne,
Theater,
like from
yeah,
there. So we
theater
have.
medical students, yeah.
Absolutely. So we have already our stems are given and our dialogues are given and what to answer and what not to answer. So most of it would
Scripted, yeah.
be, yes. So most of it is we've been advised is only give the information which is to the point. And majority of it, if they ask you extra questions, we are meant to say, no, no, either no, no, sorry, I don't know. That's it. So that was what was instructed to me. And in case of, I had a psychiatric patient, I mean, as a psychiatric patient, I had to go to do a role play. In that, it was literally minimal information because I was a depressed patient. So to take
Okay.
something out, so to take something out of my mouth, that's what I had to play. So that is how the scenario would be. So it changes from one or the other. So that's what I just thought I'll just let you know how it is being
No,
played.
no, that's yeah. I mean, it's all like a gameplay in that exam. Yeah. So
Yes.
anyways, I mean, you all will get through. I'm pretty sure about all those things actually. Um, Yeah, if it's relevant, usually, you should answer. I mean, because in some cases we don't know, which one to answer and which one to not. So that is one of the things. It's better to answer something little bit actually. Currently, we don't have info. Like, there's another way of tackling. I'll show you guys in someday. Dear doctor, currently we don't have information regarding that, but we'll get back to you. So see, technically or passive way, I'm answering that one. So I don't know. I mean, usually it's also cutting off marks as far as I know. You can't really say I don't know. Yeah. So we'll get back to you. The technical, sometimes it's the thing actually. And the level can be some cases different in MC2 versus the med school level. Some cases can be different. In MC2, they have their own, judgment and the things. So usually it is, as far as I know, it's better to tell something and tell, like, in passive way, like, see, dear doctor, at this point we don't have information about this, but we'll get back to you as long as we'll get some information about it. Okay, so if you don't know this, just technically, so that carries more mark. Usually it is told in that way. Yeah. All right. All right, any more questions? Oh, okay, doctor, you can inbox me for that. No worries, Dr. Ayodeji, yes. Um, Admission for the courses, you can drop me messages. Actually, we'll get back to you in next 24 hours. No problem on that one. Yeah. About mock test in the courses, but mock test, it's like a doctor. We have, I personally don't usually do it, but the other instructors, it's like separately purchased mock test, can be arranged actually. Yes. Yeah, we'll take another class, today is a Saturday. So my dear doctors, just give me a second. Today is a Saturday. Next is a 10th. So 10th we'll take a class, and on 10th I will give you this whole schedule. Okay, guys. Today, I couldn't bring that schedule. Sorry about that. But next day class, I'll give you the whole schedule of the coming months actually, so that you can get a very more clear view, how the classes, and you can plan everything accordingly. Yes. Yeah. Great. I just came actually, from some of I just came from Bangladesh just yesterday actually. So yeah. Yeah, but classes are Saturday and Tuesday. That's how we take. And if any extra class slot, in that case, we organize in Wednesday usually. Yeah. This time, one thing it may happen. Uh, Most of the time, usually we start with pediatrics, but this time we may start both pediatrics and medicine simultaneously. So that we may do this time because it's quite relatable. And also maybe Intasar can give some hands to me, I was thinking, so that will be nice in that way, actually. All right. And is another reason that there are some doctors who are April candidates. So they also requested, if things, the major important things can be done, actually. Our courses are usually 4 months, but we like to cut short to 3 months this time, actually. Yeah. As you said, next day I'll talk to some of my tutors and we'll come back to you, actually. And one thing we do, I mean, all the doctors, we give the previous batch materials. So this is another plus point. So before coming to the live class, you can also check um, some of the contents from the previous batches as well. So this is a plus point of this current batch, actually. So you'll have the contents. If anyone has exam in April, you don't have to worry because you'll have the all contents and you can go with the live batches. So a lot of candidates from, I think, April, May, actually. So we have little idea on that one to not to stretch is too much and finish in time in like probably in January, February. By end of March, we have the plan to finish this time. Okay, one question, is online exam applicable? No. It's also for Australia. I think most of my students in Australia, they took that exam. I mean, the result I show you earlier, most of them living in Australia. Why not to take chance? Okay. Everything, there's a word. Everything is fair in love, war, and in MC. Right? So it's okay. I mean, they are making exam tougher day by day. I mean, so of course, if there is something we can do, of course we'll do it. Good question. Study partner as like same like before, but yes, I mean, in coming days, I'll give you more advices. And since we don't have much doctors here, I mean, I try to make pairs in the classes. So if anyone not having study partner and coming to us for like, surely you will get a study partner here because we try to or make groups actually, because in MC1 there's like very big, classes like, 150 200 join sometime even. So it is very difficult like individually to reach. And but here in MC2 it's like a just 30-35. I just stop admission immediately whenever that 30-35 So as I said, it's just mostly to work with the doctors I'm comfortable with. So we're more, I mean, we're happy to give even discount to our students. We don't mind. But if you are being a good students previously, you are, I mean, I'm more than happy to welcome you here. Actually, I'm more comfortable. I mean, I work more hard. I feel like, when close people around actually, because some came, don't know me. Also, I don't know them, the rapport and attachment don't work in that way always actually. So I'm more into the doctors who has passed from our academy will be the priority for me first. I mean, here it's not a first come first serve as like MC1. Here is like priority is our MC1 candidates. If they are finishing the admission, the others may cut off from admission actually. Different rule, it's okay. It's just I just want to be um, good with the results and the things actually. That's all that matters for me a lot actually for as a academic head. Yeah. The timing of the exam, just a second, this question. Oh, you mean the shifts? There's morning shift, there's evening shifts of the exam. There's two segments, yeah, on the exams. Like in one day, almost 40 doctor can give exam. There's a one group, 20 doctors go in the morning shifts, another 20 doctors go in the evening shift. Clear, everyone? Good question, actually. Any other technical questions like that from the beginners? How many hours? Okay. See, normally usually it takes like approximately 3 hours, I think, overall for the shifts, and releasing them another half hour. So almost like a 3.5 hours, some break in between, then the another group they start. So it's kind of like that. But if it is online based, I'm telling you, it takes, I mean, last the doctor attended, she said for 7 hours they were there. 7 hours. Because they keep checking the security, keep checking the security. Someone's line is cut, then everyone is in the online. So they said 7 hours they have to sit for online exam before they finally, yeah. So we'll talk about those things, how to assure the good internet and all these things. Don't worry, we'll talk about that. Yeah, it's like that's one of the drawback. That's one of the drawback in that internet exam. Some doctor asked, like, if there is anything happen due to internet and the thing, can we redo that station? Most cases it is a yes, actually. Like when you come back and join the immediate next one, then you will be taken to the waiting room. There is an option in the Zoom waiting room. So even if you see the exam is finishing, some extra doctors are also sitting in the extra routine. It means some of their stations were not completed due to technical reason or any internet. So they are also given time to finish in another station, most cases. Anyways, we'll talk about that one. Any more interesting question? Now dates are on them. This is an important question. Can I book MC2 exam now? No. Unfortunately. So it depends when the dates are opened actually. Yes. Any difference between no much difference, my dear. I mean, but academic wise, I can tell in online based, we get to get more good result because we targeted that online one very strictly. Yeah. So far, if I say that almost like a 10% deviation I found in my academy in terms of the passing in online versus that one. As I mentioned that, some of the doctors are shy, introvert, and not doing physical examination for a long time. So for them, that online become more blessing actually. So some of the doctors, I tell them, you please don't take, uh, face to face. You do online. No, sir, um, everyone is telling face. No, no, you go for online actually. So for some of them, I force even to go to online one actually, because when we do role play, we understand how someone is. Yeah. So based on that actually. So we can pray and hope the online one remains there as a bonus. But some of you are very well spoken. You don't have to go for online. You can always go to that the main center one actually, Melbourne. Someone asked, do they give our preferred dates for exam? I'm not very sure. Like, see, if April dates came out, that is like, April month has a 6 dates. Those are your choices, most cases. I mean, once the portal is open, then among that 6 dates, you can choose one. There's another thing, next day, I think Intas sir will come and tell his story about booking date actually. I think that will be good. There's another way of you can emailing them, keep emailing them and getting date. I think Intas sir will tell you about that one actually next day. Okay, Dr. Shara has a nice question. Online exam can be done from our own house. Yes, from your own house actually. Example, I'm sitting in this room. This is my house. So in the same way, but they'll ask you to, move this, that, right, left in that way. Yeah, that's the thing.
So, doctor, I just want to speak about the booking, the process, because I got a date. So when I asked for the booking and requested it, I put the preference dates. And then when I came...
You email them, right? First
yeah,
you email them, right?
First thing,
Email,
I took the preference. And I didn't get the answer back. And they told, when I emailed them, they told me we're still putting people in dates. Then I sent a long message requesting them to place me in exam.
Yeah.
And then
Yes.
I got the answer. All right, if you're that keen to get into the exam, just pay the payment and we'll put you on the preferred date. What was your preferred date? And then they gave it to me.
Right. Understandable. Yeah, makes sense actually, so the same story with Intasar and 1-2 others as well. Just they were keep requesting for a date, initially they were requesting for a date, give us a date, give us a date. So that was the thing, then they get a date actually eventually. And earlier it was even more difficult because, there's a lot of backlog. You all know because of COVID, there was a backlog of lot of, that's why the online been introduced actually. When the backlog would be over, then I think online would be called. But I think my prediction 2023 would be there because still there is backlogs. Still a lot of doctors couldn't appear in the exam. They need to clear them of those 2-3 years, so many, right? So that is the thing. So I think 2023 would be there. So you guys should try taking the chances. But whom to go to center, whom to go to online one, I'll tell you after doing few role play. I'll tell you guys on that one on the basis of that. Yeah.
Sir, for the clinical examination dates, is it first come, first serve? When booking the dates?
You mean when there's 2 way, as I mentioned,
Okay.
as I said, like the booking one, I think let Intasar talk would be more better because they have been going through a lot painful processes of booking the dates. Any Intasar, they all passed now. So I think it's better they will talk. I think would be better actually about the exam booking process. Yeah.
Okay. And so just one more question.
Because yeah, sure.
Yes. So like part 1 exams where you have like from February to November and it's only once a week. So is the same, the dates for the part 1 is usually only, it starts from February and it's
December, January. Yeah, December, January. Usually there is no exam. There was an exception. It's one time there was exam one in December we saw in past actually, but usually there is no exam in December, January.
It's the same is applicable for the part 2 also.
Part 2 as well actually, but getting date is difficult here actually. I mean, in AMC 1, if not like after 2 months, after 3 months, you can see the dates always. The biggest difference is you cannot see the dates here actually. You have to depend on them, their website, and people talking in different forum. Oh, dates are coming out. Everyone keep asking also us, sir, do you know when dates are coming out? So there's a lot of this kind of thing happens before the dates coming out. Eventually we'll get to know, I mean, from the WhatsApp group, Telegram group, or from the AMC official websites actually. Someone will post a screenshot that, oh guys, dates are coming out, so or some cases email as well actually. Email, as I said, like I don't want to get into that process because I don't know that process very well because we didn't go with the email process in that way.
Oh.
But Intesar has gone through that email process, actually requesting, and
Okay.
eventually get. Henny also did in that way. So there is another process. Maybe when our main classes will start, then they will talk about that actually.
Okay. Yeah.
Yeah.
Because
A
after
few
the
things we
part,
cannot tell.
yeah, because after the part one, after I passed, actually AMC had sent me an email saying the dates for, because this is back in December. So they sent an email saying to me that the dates for February has been opened. If you would like to book, send me. So I was like, I have not even started the course for part two, so I
Oh
have
yeah,
no
yeah. You
idea.
texted me. No, no, no. I said no, 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 no. That's like that will be suicidal attempt. That.
Yes.
Yeah. Maybe they're looking for more money.
Maybe. Sure, sir. Thank
you know
you.
it's like an individual exam has cost a lot actually. So yeah, so maybe they might think you might be rich actually, so they might send you this message.
Oh God, no, no, no.
Yeah.
So, hello, doctor.
Okay. Hi, doctor.
Hello. Oh, so this is Dr.
Hi.
Aisha, and
Hi,
I
doctor.
already enrolled in your clinical group,
Sure,
and you
doctor.
shared me all the record, and I did the peds and
Okay.
ops section. So I just want to ask, I want to book the exam in May, June, July,
Hmm.
and they're gonna release the date in late January. So I want to take that I should book the exams before completing my course, or should I first complete the course and then book the exam? That I want to ask.
What dates they are offering you? May,
Uh,
June, right?
May, June, July. Yeah, they will release the date of these 3 months in
Okay.
late January. They email me.
Then maybe because you have joined, like it's been, I guess, 2 months, is it, like, or three
Yeah, yeah.
months?
Yes. I've done
Yeah.
peds
So
and ops and gynae.
pediatrics. No, but you are again getting chance to review and do role play. So why not to
Yeah,
take chance on that? We're starting in January. So January, February, March, um,
yeah.
the main section will be trying to cover. And
Okay.
in April, maybe there will be some activities for April candidates actually. So if you see that one, that
Mhm.
January, February, March are the main courses,
Yeah.
and April there will be some activities from the April, because April has a lot of
Okay.
candidates. and
Okay.
and so if you take the exam on maybe June, I mean, that's better
Mhm.
in that case.
Okay.
Yeah, I mean,
June.
you'll get a
June.
month of June
Uh,
actually. Yeah, June would
okay.
be, in that case, would be
So,
better. Yeah.
is there
And
some different of months, as you told us in part one, that don't book the dates for the June, July?
mm,
Is there a difference?
doctor, doctor will talk about it, because today we are in an open session. Yeah, in YouTube.
Okay.
So
Okay. Okay.
let's
Okay.
not
Fine.
talk about that. Yeah,
Okay. Okay.
yeah.
Okay. Thank you.
I'll talk about those things in a private class someday.
Okay.
Yeah,
Okay. Okay. One more question: that how months
sure.
our this session will consist of how many months? Like this course, this clinical course.
Oh, this one.
Yeah.
This one is, I mean, usually previously it was taking 4 months. This
Okay.
time it's also 4 months, but the main sessions will try to cover in January, February, March, and there will be
Okay.
some activities in the April actually, because there are
Okay. Okay.
April and
So
May candidates
hope.
actually. So
Okay.
yes,
Okay.
so I'll be, in next class you will get a very clear view on the routine actually, because
Okay.
I just came yesterday, so I couldn't make
Okay.
the full routine. So, but
Okay.
in next class I'll come with the full routine. Then I can give you a very clear view that exactly
Okay. Thank you.
what date we are finishing. Yeah,
Okay. Okay.
100%, 10
Thank
on
you.
10. I'll tell that one.
Thank you.
No
Thank you.
problem.
Thank
No
you.
problem. Thanks. Nice questions, by the way. And that I think that is one of the question that I think I can only answer when we'll be in the private sessions. Actually, I'll tell about that one. Actually, uh, some guidance on the exam months and the dates, actually that will come to time, no worries. uh, Guys, any other interesting question? And another thing, very soon, I think, as I mentioned, probably Dr. Intasar will bring him into, just to show how to do a role play, and because he's OZ, so you'll see the accents is different in his case. And so we'll do a role play in that case, and I'll show you, to how to do a regular way, how to do in fast way. I'll try to do that. So and he can also guide you through. I mean, either Intesar or Henny also passed recently. They all secure job as well. Very interesting and good to see these people. passed MC2 and quickly also secured job actually. So here is the thing, guys. Actually, see, there is always more chances of getting job if you finish the MC2. So rather than my opinion, especially our students, that uh, see, don't really, let's not stretch this too much. Okay, let's finish this MC2. I mean, already so many years have been gone from life, right? So you can wait. I'm sure you can wait for a while to finally finish it. Like, when you finish MC2, at least then you should breathe, actually. I mean, there are post graduations and the things, but at least you will have a stable job now. You can take a break, you can lead a normal life and just duty, come back home, you know, uh, see the family, and but how our life is going, every time there is something buzzing in the head. Okay, I have to come back to home, see the family, do this, that, but at the end of the day, again come to the desk and study so many things, right? At least that headache should go away, at least for some time, at least for 1 2 years. Actually, you can take a break. Then if you have aim for post graduation and the thing in Australia separately, also there is a GP system. We'll talk about that one, FRSC GP. And also I'll talk about how to do the fellowship in Australia. Actually, I'll talk about that one maybe. See, I mean, nowadays, I know at least some of our 300 doctors, they have been working. Some already entered into the post-graduation system, so we can invite them actually. So, I mean, they will say no. I mean, won't say no, I hope. So no problem actually. So that's the benefit we can use actually, because a huge number has passed and they've been successfully working. So some we can bring. I mean, one we can bring from WBA as well, like whoever in the WBA system, one in the GP system. So now a lot of people is already entered in the system. So that was my aim actually, to share information, gather information together. Because in Australia, if you see, the major problem was a lot past. If we go, I mean, there was no information. I think I was the one who opened YouTube channel for the first time, and then people start getting knowing, the MC, even there is a MC exam, and this is 2 parts, and these are the books to follow. Actually, even when we started, there was nothing in the web, to be honest. All thing we know, there is a book named John Mottpack. Nothing else we know actually. Yeah. And what system, what this, that. Yeah. So now, with time, system get updated. Seeing me, some other also update the MC and the things. And I wish their website could have been a little bit more easy. Actually, their website is more complicated. That's one of those problems. And even the booking process of the exam is still complicated. Actually, in PLAB, USMLE, it's much more um, easier. At least the booking system. PLAB 1 is very much uh, bad situation going on, especially with PLAB 1. Actually, there is no dates for almost, I think, 1 year. You don't have any dates for PLAB 1 currently. All right, so but PLAB 2 still you can book a date. I mean, the booking process is not this complicated as like MC. I mean, you just go through the portal, you can see the dates, when you pass, and you can book an exam. All right, so that's how it should be. Now here we have to wait when they will publish in their website, or we have to keep emailing them, and they, and I don't know their biasness or not. See, in both of their cases, like two of my close students, Intisar got the date early. Maybe he's living in Australia, or maybe I don't know he's OC or not, if that can be the reason or not. So he got it early. Then after probably 2 3 months, then Henny, she was in Iran, she got date later. Yeah, but all were studying all together actually. So one get a date early, one. So there's not a clear, transparent process in their exam booking thing. So they give priority. They always give some priority. Those are inside Australia. Even in terms of the job, I always keep telling. I will tell you more about these things. If your visa status can be shown that you are inside Australia, there is a much more probability that you secured the job more early. Unless in on the other countries, if you have a very fantastic experience. And it also depends on web browsing, convincing, and maximum application. We'll talk about in that seminar. Don't worry about that one. Yeah. Any other last question before I left, guys? I hope you enjoyed the session so far. I mean, trying to give you a very clear view, at least how the exam looks like. Next day we'll talk more about how to take history taking. I'll show you how to take history taking properly, most importantly, and I'll take the history in regular way. I'll also show you how to take a history very fast way. You can see 8-minute history, I'll try to finish in 6 minutes. I mean, those particular things. Yeah. So I will also show how to finish a station in 6 minutes actually. So those things I'll also show you, but marks should be equally given. Yeah. So I'll not take cut short, but some languages changing might be you know save the time, that I will show you definitely. So thank you so much again, guys. Have a lovely day. Hope you enjoyed. Our next class is on 10th. Please inform your friends those missed the class. I'll just upload the recording in our Sharier's MC guideline group. I think most of you are there. I'll just post this recording there. And you can invite your friends on the 10th. They can also come. And yes, yeah. And those of our already academic students, please encourage those who have been more studious in the classes, tell them to join. So there will be a lot of activities and the things this time. Yeah. All right. Thank you.